Dr. Christy Ennis. Welcome to Follow Me Friday. Today's focus is on strengthening those abs without putting strain on that back. So not only will you get stronger, but you're also going to help alleviate some of that discomfort that you're feeling. There will be some standing exercises and some lying down exercises, and you can feel free to do these either on the ground on a mat or just go right into bed. No problem whatsoever to do it that way if getting on the ground is uncomfortable. You will also need a dumbbell and a band. It doesn't have to have handles on it, but one that you can grab onto and throw it around something sturdy. I have a lovely bar here to do that with. At home, I often recommend people either tie a knot and slam it in the door or even wrap it around a railing. One of those options should work for you. So we're gonna get started with some of the standing band exercises. We are kicking it off with 3 band exercises. Remember to play around with this little position in your pelvis too to see what feels better on your back. Sometimes it actually feels good to change it a little and unlock things. And then always think about engaging through those abs too. So first one, standing with a nice comfortable stance. I've got my palms down. I'm really thinking about, engaging in through that center, and we're adding a little straight arm pulse for 20. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Notice nothing but my arms are moving there, right? All right, from here, you're gonna step it out a little bit. Arms stay straight to start. We're gonna go down into that bit of a squat. As I come up, I'm adding that row because I'm getting some cross stability now from some other muscles. So that's 2. 3, I can't squat very low. You guys, if you can squat lower, you do it. 4, 5, 6, a little gentle squeeze of those shoulder blades, 2, 7, 8, 9, and one more is 10. Nice, good. Okay, I'm coming back a little bit. I'm gonna grab both handles. You can always grab, both little straps there. A nice comfortable stance again. I'm thinking about squeezing right in here, and I'm gonna pull off to that side. Not turning my body at all, right? I'm actually anti-rotating, trying not to do that. So working those muscles without twisting and turning. Sometimes that doesn't feel great on the back, right? That's 5, 20 total. 6, always a little bend in those knees at least. 7, back up a touch. 8, 9, 10, that's halfway. 10, 9, 8, 7, a little arm workout too. 6, 5, 4, 3, 2, and 1. Good, we're gonna get rid of the band and pick up our weight. 3 more standing, 2 with a weight. So for this first one, again, making sure everything's of course engaged, we're gonna make a lovely figure 8. So we're really getting all of those abdominals. It's okay if it doesn't look exactly like an 8. I'm gonna make you switch directions too, so woo, brain exercise. That's 6, 7, we'll see if my brain is working today. 8, 9, you should really feel all of this stuff working. And 10, and now, like I said, see if my brain is working. Going the other way. 1, 2, I don't think I'm making an 8 anymore. 3, 4, as long as you're getting all those motions. 5, and I'm only using a 5-pound weight here. 6, 7, you might be a little bit more beefcakey than me and you can use a heavier weight, no problem. Here is 10. Okay, we're starting off on one side and I'm coming up and around with a little march. And we really have to use that core to help stabilize us when we're lifting a leg. If, however, you find it doesn't feel good, you can't get your balance, it's okay to just stay right like this, okay? No problem. So, 6, 7, woohoo, 8, 9, 10, halfway, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. I'm gonna put my weight down and go over to the wall. We're gonna get a little push up and a tap out. So if it's too easy for you on the wall, you just go ahead and decrease the surface down to a counter, a table, and to the floor. I am starting on the wall today. So, right, everything's engaged here. I'm adding that little push up as I come back out. I'm giving a little tap with one leg out to the side and a tap to the other without twisting and rotating. So making myself have to stabilize as I move. That's 2. We're getting 10 total here. 3, a little dance move. 4, 5, that's 6. If you are looking for a total body workout after you've had some back pain and looking to get back into it, check out my Body Vitality back pain series, which goes over the whole body, including some stretching and some mobility too. 1 more here. Woohoo, okay, going right on down to the ground. Okay, we are finishing up with some exercises on the ground or on the bed. Don't forget it's okay to do that if getting on the ground doesn't work for you. First thing we do want to go over, briefly at least, is engaging in through those deeper areas of stability. Number 1 are those pelvic floor muscles, or Kegel muscles as they're better known as to a lot of people. Those are those really deep, right, ones you can't see from the outside. So a quick little tip for that is think about pulling a marble up and inside without, right, squeezing everything else. I'll link a video on that as well. Step 2 is getting a comfortable spine position, right? Especially if your back is bothering you a little bit, it may be a different position than you're used to. So for me today, it's about right here, and that's okay. Wherever you are is okay. And then lastly, just think about gently pulling that belly button in, not so that you're arching the rib cage or the pelvis, but like if you eat a bit of a larger meal and you have to get your pants back on. Not Thanksgiving Day full, just a little bit full. That's what you're doing, right? Not the whole rib cage. So, and breathe. There's a lot of things to remember with this one. Do the best you can, okay? Try to keep this position as stable as you can. So from here, we're actually just gonna start by bringing this leg right out to the side and back in. A lot of times we'll have people put their hands right on their hips so they make sure the hip isn't dipping at all and they're not blooping or pushing their bellies out. And even though this is a small movement, I can feel this. That's 4, we'll get 10 on each side, so that's 5, 6, and some of these muscles actually shut down when you have back pain. So it's not even necessarily a matter of weakness, it's a matter of we gotta get those muscles in the brain to chat with one another again. And then we're switching to the other side. Pay attention, you may find that one side is easier than another as well. That's 2, 3, so you won't always have to stay right at this level, right? 4, you'll be doing some fancy schmancy stuff in no time, hopefully. Be smart and listen to your body though, right? Always. That's 7, 8, even my glutes are engaged in here, I can feel it. 9, and 10. Okay, from here, we're gonna add a little march, and I'm gonna add an arm motion with it. So my arms are gonna go up this way a little bit. As I lift this right knee, my left arm is gonna go overhead. Same idea with that position in through the spine. That's 2, 3, 4. I always caution people to keep at least one leg on the ground when they're starting off after having pain, just because you don't want to do this kind of thing. You'll get there eventually, right? 7, 8, 9. I may have miscounted, sorry. 10, 10 more. 10, 9, 8, 7, 6, it's like a little robot a little bit, 5, 4, 3, 2, and 1. Good. From here, I'm going to bring my feet just a touch wider. I'm going to tilt as long as it feels okay on your back. You do this too. Just tilt my pelvis a touch more. I'm coming up into a bridge. So yes, using those glutes, but those abs still have to work here. Make sure that you're only lifting as high as you can so that it doesn't hurt. And then from here, you're just coming right back down. Easy peasy, hopefully. Again, even if that just means you lift a tiny bit, if that's what feels good for your body today, that's okay. 10 of these, there's 3, 4, 5, 6, 7, 8, 9, and one more is 10. All right, I'm gonna flip it over onto my hands and knees. And of course, not just with back pain, but in general, you always wanna move carefully, all right? So in this position, I'm gonna be, like I said, hands and knees, try to stack those shoulders over those wrists. We're gonna start by just bringing that leg out and back, no arm movement yet. So it's just a little extend back to the middle. Because again, just like some of the other ones, we're just trying to keep everything else kind of steady here and only moving that leg, no twisting or dipping. So that's 3, 4, 5, 6. Sometimes you might need to have somebody at home watch you do this one to make sure you're not tilting. 8, 9, and 10. Now, if this was challenging for you, you stay right there. If that felt pretty good, you can add in that opposite arm. So, but again, not arching or any of those things either. That's 1, 2, 3, 4, just getting 10, 5, 6, 7, of course, breathing, 8, diaphragm's part of our core too, 9, and 10. Good job today, guys. Hopefully you feel a little bit better and a little bit stronger. Thank you so much for tuning in today, you guys. If you want to get rid of pain anywhere in your body on your own with just one little portable device, don't forget to check out the Derma Edge. I created this while I was going through Lyme disease to help get rid of my pain on my own, nice and gently. It's patented and made in the US, actually right down the road in Laconia from where my office is. So don't forget, you can click the link here or in the description to order your own.